So the data that we need to understand men's and women's fertility and low fertility and aging in different populations has to have a few characteristics. The first is it needs to be timely. It also needs to be accurate. It also needs to be fine-grained, and we need to have a multitude of different types of data. So in terms of timely data and in terms of being fine-grained, I think that CoStat Statistics Korea has done an excellent job actually at looking at and producing this kind of data. So we need projections that we don't want to wait 5 years or 10 years for slow data. We need really rapid predictions, and we need to collect that data almost in real time in order to make effective policies. Another thing that we need to have is really fine-grained data. So if we think about geographical projections or projections on a fine-grained timescale, those are really important because then you can be more reactive. You also need data that comes from a multitude of different sources. So there can be a tendency when you're looking at fertility policies and family policies that you only focus on things directly related to that. So think about tax breaks, child allowance, parental leave, all of these different aspects. Now, those are very, very important to have data on that, but actually we're realizing we have to take a more systems approach. We have to look at all of these interconnected things. Think about the education system. Is there after-school care? What are the hours of the education system? Is it very competitive? All of these different aspects. Or what about housing? Are people separated? Does it take them a long time to commute? So in Korea, for example, they have double the commuting time as compared to OECD countries. So commuting and housing is really important. We also have to think about medical records and data as well. Mental health, physical health plays a really important role. We have to think about labor market data. What are the rights and the protection, and do people have long working hours like they do in Korea? So all of these things combined together make us, is the type of data that we need in order to understand why we have low fertility societies. Another aspect we need to think about is not just data, but also the methods that we use. So it can be very difficult to understand causally which policy has influenced which outcome. So then we need to think about different types of techniques. You can use randomized control trials, for example, where in one region you institute a policy that's different in another region to see, did that policy work? But you can also use things such as natural experiments or changes in policy. And increasingly, we're combining all of these different data sources together to use machine learning approaches to see which aspect is more important or which one has more relative importance in comparison to other aspects. And that allows you to include thousands of different variables and really understand the system as a whole.